Hey, this is Matt with another Core Clinical Concepts video from the Canberra Acupuncture Clinic. What I want to talk about today is a concept of patient-centric medical care and disease-centric medical care. So what we're experiencing most of the time nowadays when we go to the doctor is disease-centric medical care. We come in, we complain about that we're not feeling well, and the doctor will try to find a label of a disease that will fit our description of our subjective feeling, and then this is often being double-checked or investigated as well with objective markers in terms of lab workups. This model, it served us well. In some areas it serves us very well if you're looking at viral infections, bacterial infections, and we're looking at acute medical care when there are very specific parameters that have to be identified so that we don't die straight away in situations of accidents or more severe cases of, for example, in diabetes when our blood sugar level goes out. So what do I mean? What is patient-centric care? Patient-centric care is an approach in which we will find out what causes led to a current state of a patient's state of wellness or disease. What's the story that led up over one's whole life to one's current state of health? And it's about really the patient, their environment, the food they eat, the exercise they do, the environment they get exposed to in terms of environmental factors like purity of water or the influence of pesticides in the environment, the emotional predisposition, the work they're embedded in, their family, the family history. So all of these is like we try to find out through focusing on the patient's story what are actually all the causes that are contributing to the disease of the patient. So this is in stark contrast to a system in which the disease is a major focus. Okay, what disease is it? Where does it come from? And what is the pharmaceutical medicine that we can give to eradicate the disease? This only works to some degree. I don't say that it's completely wrong, and I'm a great supporter and admirer of Western medicine, but at the same time I want to encourage people to think a little bit more with some common sense to find empowerment in their own health by finding out what can they do to actually improve their health if they're not healthy. Okay, so this is why I made this video, patient-centric care versus disease-centric care, and I want you to think about what type of care do you want? Do you want to be labeled and being put into a box by having a name, disease label of a disease? Or are you interested in taking responsibility and finding out what are all the causes, what are all the conditions that led you to your current state of health, and then most importantly, what can you do to actually change it and come to a high level of vitality, a higher level of awareness, a high level of happiness, because you took charge of your own health with the support of integrative medicine practitioners. Okay, so that's what I want to encourage you about this and educate you in this video. And yeah, please leave me a comment below and let me know your thoughts on this. Thank you.